Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to share a summary video that includes treatment recommendations for patients that I see that have fatty liver disease, prediabetes, diabetes, and obesity. I have discussed this treatment in depth in other videos, but today I just wanted to give a summary video and give a brief explanation by each point. When I see a patient in the office, I have many handouts that I might give them based on their concerns or complaints. For patients that are concerned about prediabetes, diabetes, fatty liver disease, and obesity, I have a short phrase type handout that I give them. I'm going to review that handout today and then also give brief explanation about each point. The basis behind these recommendations is that insulin is the driver of prediabetes, diabetes, fatty liver disease, and obesity. With that premise, anything that reduces insulin has a benefit on these conditions. You will notice that exercise is actually not included on this list of items. I want you to realize that I prefer my patients exercise. I believe it's very important for their overall health, especially mental health and sense of well-being. Many people feel like they can't devote a lot of energy to exercise because their health is so off kilter. Sometimes that has to be added at a later time. First on my list of recommendations is no added sugar. Sugar is always going to be your enemy in these health conditions. Sugar triggers insulin release very quickly. Sugar should be an obvious one for most people. Of course, that would include no sugar containing drinks. Any type of drink that has sugar in it is digested very rapidly and absorbed very rapidly, and any intake that you have is amplified in intensity because of this fact. Limit artificial sweeteners. This one is a little bit counterintuitive for some. I'm okay with artificial sweeteners, especially as a bridge when patients are trying to implement lifestyle changes and are struggling with certain foods. I think there is evidence that artificial sweeteners, at least certain types, can increase risk of health problems and even obesity. It has been shown that artificial sweeteners also trigger cravings for some. These artificial sweeteners can be a gateway to eating more sugar, which would of course sabotage your efforts. Next is limit carbohydrate intake. This includes bread, pasta, cereal, rice, and potatoes, all the things that people love. These type of carbohydrates stimulate insulin release and once again work against your efforts to treat these conditions I discussed earlier. Specifically, it is important to avoid processed grains. Refining or processing grains takes away a lot of the nutritive substance of the grain. It removes the outer bran and the germ part of the grain, leaving only the endosperm part of the grain left. The endosperm is mostly carbohydrate. The other aspects of the grain that are removed are the vitamin and mineral content as well as the fat content. Fiber has been shown to be beneficial, so removing that part can be a problem. Fiber helps you to bind and increase the stool bulk. It also helps to allow you to excrete more of what you ingest. Fiber slows down the process of chewing and actually can make you eat slower, which can have a benefit on overall intake and decrease weight in that manner. Ultimately, slowing down the process of converting the starch to glucose is beneficial. I'll read a list of a few types of what are called whole grains that should be better for you. You may want to limit these to a certain degree, but compared to processed grains, these could be very helpful in your diet. They might include barley, brown rice, buckwheat, bulgur, kamut, millet, quinoa, rye, sorghum, spelt, triticale, wheat berries, and wild rice. Another protective dietary element could be vinegar. Some people use apple cider vinegar, and in short-term studies, this has been shown to decrease insulin levels. I am always in favor of my patients eating protein. If you go overboard on this can work against you. Protein does stimulate insulin release, but in a much more moderate way compared to carbohydrates. Protein has the significant advantage of keeping you full longer. Fat intake is important. This has been something that has been railed against by medical professionals for years, but fat intake actually improves feeling full, your satiety. Fat also does not stimulate very much insulin release, so it can be very helpful. So butter, cream, eggs, meats, these are going to be okay. Next, I would like to challenge some of the conventions that I was taught and many others have been taught. One of those is always eat breakfast. This is not necessary if you don't feel hungry. I do not recommend eating breakfast. There's no evidence that skipping breakfast has adverse consequences on your health. In a similar light, avoiding snacks. In other videos, I've mentioned about how the number of eating events per day has significantly increased. Medical professionals, including myself, have advised patients to eat small, frequent meals instead of eating large, less frequent meals. Evidence is not supportive of this, and every time you eat, you're stimulating insulin to a certain degree depending on the content of your food. If our goal is to reduce insulin, then we need to decrease the amount of eating events. This leads us to intermittent fasting. I feel that intermittent fasting is probably one of your most powerful tools. People worry about the price of food. Well, here you go. This is not eating, so you're not buying any food. Obviously, you can't fast continually, but having alternate types of intermittent fasting methods can be very useful to keep your body guessing and to keep that insulin level low. Once again, our goal is to keep the insulin level low if we want to reduce the risk of these health problems we have discussed. I have particular videos devoted just to fasting to explain it, but many people fast for 16 hours and have an 8-hour eating window. Many other people do 24-hour fasts, and some people do even longer, 2-day or even 7-day fasts. All these are fine. You can have water, black coffee, tea, bone broth. Fasting is a great tool for keeping your insulin level low. In other videos, I've discussed sleep and stress is very important for overall health. If these conditions are out of control, it's very common to have high cortisol levels and as a result have high insulin levels, which will work against you with these health problems that we have discussed. When I'm counseling my patients regarding these health problems and I hand them a piece of paper that has these recommendations on them, I understand that patients may not do all of these things. Sometimes one or more of these things will be much more aligned with their abilities and their resources. I want you to have the information, and if you're able to do more of these things, your chances of success are greater. To be honest, we have brought these health conditions on ourselves mostly by not paying attention to nutrition and lifestyle factors. We have a chance to turn this around though. I have witnessed many people that have improved their health significantly by implementing these practices. If you are my patient, I hope you found this information useful. If you're not my patient, please see your own physician to discuss your diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life. Take care.